Ever pondered over the prevalence of mastitis in dairy herds? Well, it's a common concern in the dairy industry worldwide, and one particular culprit is the bacterium Streptococcus agalactiae. To understand this issue, we need to dive into the etiology of the disease. Streptococcus agalactiae is a major pathogen of the mammary gland. It's a common cause of contagious bovine mastitis in several countries, especially those without an effective mastitis control program. This bacterial invader is a highly contagious obligate pathogen, and its infection is often transmitted during milking. Speaking of prevalence, it varies depending on the effectiveness of the mastitis control program in place. In dairy herds without a robust control program, anywhere from 10 to 50% of cows and 25% of quarters could be infected. However, in herds with an effective control program, the prevalence of infection is reduced to less than 10% of cows. The good news is that with the right treatment and control, Streptococcus agalactiae has been eliminated from many herds. Now let's talk about the clinical findings. Individual repeated episodes of subacute to acute mastitis are most common. The gland can become swollen and warm, and the milk often turns watery and contains clots. If left untreated, there's a gradual induration of the udder. So, how do we diagnose this? The latex agglutination test is used for the specific identification of the organism. However, it's important to note that we cannot differentiate clinically from other causes of acute and chronic mastitis. For this reason, the milk must be cultured. Once we've confirmed the diagnosis, what next? The treatment for mastitis associated with Streptococcus agalactiae in lactating cows is relatively straightforward. This bacterium is sensitive to intramammary therapy with a wide variety of antimicrobial agents, resulting in a high rate of clinical and bacteriologic cures. Blitz therapy, a process involving simultaneous treatment of all positive cows in a herd, is commonly used to reduce the prevalence of infection in the herd. And finally, control and prevention. Eradication of Streptococcus agalactiae is indeed possible. The key steps involve identifying and treating infected quarters, culling incurable cows, pre-milking teat and udder sanitation, post-milking teat dipping, and dry cow therapy. In conclusion, the battle against mastitis, specifically that caused by Streptococcus agalactiae, involves understanding the etiology and epidemiology of the disease, recognizing the clinical findings, and implementing effective treatment and control measures. With these steps, we can significantly reduce the prevalence of this disease in our dairy herds, leading to healthier animals and a thriving dairy industry.